I'm Talya Chemel. I am a physiotherapist and I have special interest in neuromuscular skeletal disorders. So basically your sore head, neck, back, knees. And then I have a sub-specialization in women's health and the pelvic floor. So today I want to talk to you a little bit about the role that our pelvic floor plays in our intimacy and in our relationships. So if we look here, we have our pelvis. As you can imagine, this sits right at the bottom of your spine. So your spine starts at the back of your head and goes all the way down to your coccyx. And if you look here in my pelvis, you can see right there at the bottom is our coccyx. Now, our two hip bones come together and form this beautiful pelvis that sits at the bottom. We're talking about a female's pelvis in this conversation. And as you can see at the bottom of the pelvis, there is a bowl or a hammock of muscles that sits at the bottom over there, and those are our pelvic floor muscles. So as a physiotherapist, this is where I would come into the picture, and we treat a lot of muscular disorders that we see in the pelvis. We work with the muscles, the bones, joints, nerves, blood flow, and so now we're going to talk a little bit more about that. The pelvic floor has many vital roles that it plays in our life. One, it holds up our pelvic organs. So in our pelvis, which I'm sure all the Vitalab doctors know everything about, are our beautiful organs. We have our bladder at the bottom. We then have our uterus, which is otherwise known as the womb, which connects to the fallopian tubules and your ovaries, and that's where the little egg comes from. And then posteriorly at the back, we have our rectum, where our poo is stored. So if we look over here, as you can see, beautiful bladder, that is where your urine is stored, your wee is stored. Uterus, and that is where our menstrual cycle comes from. This is where a baby would be implanted, where a pregnancy would grow. And posteriorly at the back, we have our rectum, where the poo is stored. Now, a big role of the pelvic floor is to house those organs and to make sure that they're in their correct position. That's one big role. The next big role, as you can see at the bottom of the pelvic floor, we have 3 openings. So the first opening is where your urine comes out of. Second opening is the vaginal opening, where penetrative sex would occur. It's also where a baby would come out through a vaginal delivery. It's where we'd use a tampon and where menstrual cycle comes from. And then posteriorly at the back, you have your anal opening, where feces would come out of. The pelvic floor is responsible for opening those openings when we need to go to the bathroom or when we'd like to have intercourse, but also then closing those openings and keeping them nice and closed when we are not ready to go to the bathroom or when we are not ready to have penetrative sex.